Hello, and welcome to yet another episode of the Conversation Capital. So we look so closely at the statistics of the show. We're looking so closely at who's watching and who's interested. And one of the things we've picked up is it's a ladies' show without a shadow of doubt. So we said, you know what, seeing that we're catering so much to the girls and so much to the ladies or are, appealing to the show, we need to bring in a professional in the industry of female organs. And we've got gynecologist Dr. Pitsoe. Dr. Pitsoe, thank you so much for joining us. Welcome.
Thank you.
As always, thank you. And as always, we've got the voice of reason behind the microphone, Bonga Bueta. Once again, welcome to the Conversation Capital. Today we're starting right at grassroots. Often when you hear gynecologist, you immediately think 35 plus, or you think of some age where, you're womanly enough or you're, maternal enough to be seeing a gynecologist. And I think the first question we want to ask ourselves or ask Doc is, if we're going to start looking after ourselves and taking care of ourselves from as early as possible, what is the right time? So Doc, I've got a baby girl and, initially we start looking at, the pediatricians who come in and carry the child till a good 12, 13 years old. At which point do we say, okay, baby girl, you need to start taking care of yourself as a woman, as a young girl. At what age does a young girl start visiting the gynecologist?
Yeah, I think let's just go back and talk about provision of health to the young girl from birth, as they say, from the cradle to the grave, so to speak. Now, we're only interested in the young girl from the age of 5 to the age of 15. Maybe that's what we're going to talk about. Now, fundamentally, the primary caregiver in those ages is the general practitioner, who most people will go to for most things. And then there is the pediatrician, who the general practitioner will refer to most of the time if there's issues. And then there's a nurse practitioner, of course, who can either be a nurse practitioner or a nurse pediatrician, as these people are. So all these people will give a sense of overall care to the baby, highly trained in that space of overallness. But there's a point where issues go beyond that overallness, and people need to see what I term specialized problem solvers for a particular child. And if you ask me when would a girl child be ready, or when is a girl child ready to see a gynecologist, it's a very broad topic, and you need to understand that on a fundamental level there are issues of push, which means you've got to see the gynecologist no matter what. And then there are the pull ones where you've just grown up and you're feeling, shouldn't you see a gynae and learn about things and be explained about things? And so that's how you look at it. So we can start talking about what I call the push factors, which is where you are compelled as a parent, as a practitioner, to say, we should really be speaking to a gynecologist about this. Now, if you looked at as age spectrum from the age of 5 to the age of 15, let's talk about the first 5 years of that, 5, 6, 7, 8, 9, 10. What are the reasons, compelling reasons, that say to you, this young girl ought to see a gynecologist? I think for me, the first thing would be an unusual vaginal discharge. An unusual vaginal discharge that sometimes has been tried by a practitioner to be treated and didn't resolve. And if it's recurrent or repeated, that child needs to see a specialist, right?
What does it look like, Doc?
It looks like an adult discharge. Okay. I'm talking about an adult discharge in a young child. So that's in an unusual place, right? Now, the second thing for me that would be compelling, and that I see in my practice, is young girls with what we call abnormal genitalia. So there are young girls, and we as mothers who clean and wash babies need to know what's normal. So that when there's a deviation from the norm, you can react to that quickly and send a baby. And we have imperforations of the anus. We have vaginal, misformation, and all these things are easy to see for the mother who's been educated. And that is a compelling reason for that young girl to see a gynecologist early on, because some of them need surgery very early on so that the child doesn't get traumatized later on. Or some of them need a definition, so that if it's something that, for example, this is who we thought was a young girl and turns out to be a young boy,
yes.
we need to deal with those things right there and then. And now the third compelling reason for me is a young girl who bleeds, right? Young girls should not be bleeding, like old girls, you know. And so
you're talking anything under 10 years? Anything under a child
under
that's
10, yeah, between 5 and 10. That's what we're talking about, between 5 and 10, because sometimes they start early with periods. And so if a 6-year-old bleeds, that's abnormal. And that child should not even be seeing a general practitioner. That child should skip the general practitioner and go directly to a gynecologist for a very thorough investigation. If it's traumatic, we need to investigate it and see what it is. Sometimes it is a trauma. They play swings, they fall, they bleed. Sometimes it's inappropriate assault by a male person. Sometimes it's what we call a hormonal influence of malignancies. There are cancers of young kids that cause them to bleed early on. And when you see that bleeding as a doctor, you've got to think about all these probabilities so that you can come in early and help the child. And then the other thing that I think is compelling for a child of that age, it just slipped my mind. I think I spoke about the discharge, the bleeding, the abnormality. There's something else I've forgotten. It'll probably come back to me. But those are, for me, by and large, the reasons why a little girl ought to be. And I think, you know, if there's a history of interference with a child, as these things happen nowadays, you know, don't go. I mean, I've seen cases where people say, no, don't worry, it's just abrasions here and there. And certain caregivers, intending good, you know, see things wrong.
Yes.
And, you know, if you're in that space, you lose nothing in seeing a person who's appropriately trained, who knows what's normal and abnormal, and who can deal with that and go with that. Okay, so that's the first 5 years before we go on to the other things.
And so, Doc, you know, when we were off air, you mentioned something that I found so interesting. I had no idea that was possible. You spoke of having operated on kids that were like 7 years old with ovarian cancer. And you know, you've mentioned two things. You've said, you know, bleeding and discharge. But what are other symptoms that one can pick up that, you know, or what are other, you know, not even symptoms, but what are things that a child can get that you don't expect them to get? And what are the things that a mother can look out for, you know? Yeah.
And I guess the bleeding and the discharge are right there in your face for you to see as a mother, you know. The abdominal growths, which rare though they are, happen. And in the last year, as I said, I've seen two little girls who were referred to me with tumors that must have been the size of, one was about 10 by 6, and the other one was about the size of my hand.
Wow.
Yeah.
That's a big hand, Doc.
There's a big hand, you know, and so all those tumors, the one girl was lucky enough to have what we call a benign tumor, so it wasn't malignant, but the other one was malignant and had to undergo a treatment. So I think when you have these little girls, 6, 7, and as a mother, be aware that anything that's unusual in your tummy, in the contour of the tummy, has to be flat. The child's tummy has to be flat, you know. Even if the child is a little bit chubby, when they lie flat, the tummy has to be flat. Okay. So I'm not quite sure, and this is the trouble with these tumors, is that because by the time they are seen, they're big. They are, the malignant ones are really, you know, difficult to treat. But these are the things that if you are a general practitioner or a nurse practitioner, and you see a child with this kind of thing, that's a compelling reason to say, hold on, I'm not going to start thinking this child has gained weight or what. This looks like a bump. It looks like a lump. I need to push this child to see a specialist ASAP. Yeah.
Sure. So you're saying we should actually also be observing the contours on babies' bodies? And
you know, and I know it's overkill, but for that one child, for those 4 kids we saw last year, it's a major advantage to have this diagnosed early, have it treated early, because you just never know how much an extra year or an extra month would give to the child.
Now, moving forward to kids that have now hit puberty, 10 years upwards, that have started their period, what's too severe of period pains? Because I'm learning now that period pains aren't normal, actually.
Yeah.
As we're taught, we've always been taught, it's a womanly thing. You'll be fine.
That's true.
You're
taught to you'll withstand it.
Yes.
It runs in the family.
Yes.
Hours are quite hectic. Just take this or that. It's
So
normalized.
So at which point does now a mom look at their baby and say, this is a bit much?
I think the message I have, and it's a very simple message, is that periods should not be painful.
Sure.
Period. And as soon as you have painful periods, something is the matter. And in gynae language, they talk about primary and secondary. But I've been in practice for longer than 20 years. And I have now had the advantage of having seen little 10, 12, 13-year-olds who had period pains grow up into women. And I have the advantage now, having seen that, of noting that everyone who had period pains, who didn't go to school for 4 days, who was vomiting for all those days, who did that, and ended up in my practice, just about 90% of them with endometriosis.
Yes.
So that's the message to a lot of people. Now, you say you were taught, and you go to say that again, that you were taught by people who don't understand. And that's that you were taught by your aunt, by your mother, by your sister, and who say, don't worry, when you get babies, it's going to go away. When you get babies, it's going to get better. But fundamentally, it's a condition. For me, in my practice, the majority of those young girls I've seen over the years have ended up with endometriosis, different stages of endometriosis, but endometriosis nonetheless. So now when a young girl comes into my practice, I'm very aggressive. I speak to the parents. We start them on treatment very early on, and there are beautiful drugs now that can stop the periods, get them to come out of the damaging effect of endometriosis, and save their fertility, because that's what it's about. Endometriosis is almost, if not number one, maybe number two in terms of inability to fall pregnant in most women in my practice now. So it's a very big problem.
Yes.
It goes beyond falling pregnant. It disables your body.
Yes.
You can't have sex as an adult. You can't do number two as an adult. You sometimes for 5 days can't go to work. So the real thing is to identify these people early, get in early and treat them. And that's the kind of thing I would say, if you've got a daughter at the age of 10, 11 with period pains, that kid has to see a gynecologist, preferably somebody who has interest in those kind of things.
It's so interesting that there's even treatment, though, like specifically for this, because for me, it's been like, it's just something you bear, In my family, we have, my parents would even say, your aunt used to miss school and used to miss,
Yeah, it's like a badge of honor.
Yeah.
And it's spoken
like,
about in those things.
Yes,
it's a badge of honor.
So the fact that this is not something that is only we pump ourselves with Nurofen, or recently I learned about, I can't remember the particular painkiller, but the fact that it relaxes your muscles, and I found it to work way better than normal pills that I would drink. So I'm very surprised to find that there's specific
and
medicine
much more,
for this.
Absolutely, and much more than because everything else people do, where they start you on an injection to stop your periods, all those kind of things are really, they aren't going to the root cause of the problem, which is going to where the endometriosis is and sorting that out at the bottom. And I think, for me, that's right on top of my list as to why little girls ought to see gynecologists. Then heavy menstrual bleeding is another one, which is sometimes in relation to...
when you say menstrual bleed, you obviously mean before them starting their periods?
No, their periods.
Oh,
as
okay.
they have their periods,
yes.
there is a defined amount of bleeding you must have and a defined amount of days. As soon as you go beyond a certain amount of bleeding, and you can measure that by the number of pads people use, then you know you're dealing with problems. I mean, I've had a 13-year-old drained out from having periods that just are terrible.
Yeah, and I believe that you can have some kind of anemia from.
Yeah, it's called iron deficiency.
Yes,
it's a terrible anemia. And little Kay, we had to take Kay in, give her blood, transfuse her, and we had to speak with the parents and bring in this wonder drug that we used it's almost like a contraceptive, but it limits her bleeding, and in the second month completely stops her bleeding. She takes it same time every day. She'll never get her period, and she's been made to understand that you are not like other kids. So do not listen to their stories. Don't hear people say, if you don't have periods, this happens. Nothing happens. We're protecting your body, and when you become a younger woman later on, an older woman, a younger adult, then you have a much better body to deal with. So fundamentally, we're preserving your fertility.
Wait, Doc.
Because that's quite traumatic to the body, isn't it? Especially of a young child.
No, but what are you saying? Then you stop the period completely?
Yes.
Until their body is old enough to be able to handle bleeds like that?
No.
Yeah.
In fact, I have older women that I've got on the same treatment, where I've given them the treatment to stop their periods. Because in a simple way to describe this endometriotic problem, the blood that comes out of there causes the damage, almost like a chemical glue problem. So it goes in burns everything else, gets everything to be melted together. When you look at the inside of these people, there's a destructive nature of this disease. Now, if you stop the bleeding, you stop the destruction, you stop the pain. And at the right time, when people are ready to have kids, you can say, get off the medicine, you're okay, go have a child. As soon as you finish, let's see what happens to you. The pains come back, go back on the medicine.
Yes.
Yeah, that's what we do.
Sure. This is, speaking of stopping and medication that's like contraceptives, I read a tweet, and sometimes these tweets can be so bogus, and I think it's my opportunity to ask you. Yeah. But somebody said that we live in a generation where so many women are experiencing polycystic ovarian and endometriosis, and there's this like rising levels of these things. I don't know if we're being exposed to it, and there's actually now people know what's going on with women's bodies, or it really is just on the rise. I'm not too sure but this is what the tweet said. And then the person went on to say, and this is the same generation that comes from young girls just after they started their period who went on contraceptives to clear their skin. And so is there a correlation with regards to starting a contraceptive early?
Absolute rubbish.
Absolute rubbish.
There's no
and I knew I had to fact check this one, because when I read it, I'm like, because my mom was also trying to clear my skin at a really young age, and
And no, that's absolute rubbish. Okay. The endometriotic factor is mostly genetic.
Sure.
You inherit this.
Yeah.
It has nothing to do with anyone.
Interesting.
Yeah, this is why they say it runs in families.
Yes.
The same with fibroids. I've got sisters, a mother, sisters who have fibroids. Once in a while, you get somebody, no one in the family has it, and she has it, Yes, but remember, sometimes you can inherit, you can jump a generation and go collect something from there, and others can go somewhere else. So to speak to what you read in the tweet, it's a mixture of everything else. We are becoming more aware of things.
Yes.
When I was a medical student years back, endometriosis was said to be a white woman's disease. No black women, we were told, have endometriosis. And I began to understand this logic when, as I grew up, I realized that the biggest fighter against endometriosis is childbearing. So black women will start having kids a lot earlier, and that 9 months where the ovary is asleep, the endometriosis doesn't grow. And so they would have kids and kids and kids. And white women would have careers that would stop them from having children. And they would pay the price. And so this now has become a reason why more black women have that. The second reason about polycystic ovarian disease. Remember, the relationship between obesity and PCO is well known. Same as the relationship between diabetes and overweightness. So now people are eating junk food, people are getting bigger, and so what does that do? It attracts PCOS, it attracts diabetes, it attracts hypertension. So people have to look at these things as a generation of people that have changed three important things. They don't walk anymore, they don't eat from the soil anymore, and there's something else I forgot that I usually talk about. But those are the things that my grandmother and your grandmother used to have. You know, people could walk from here to Soweto, and then they had to eat from the ground and that kind of thing. You know, now you go from here to the shop, it's a local, it's a car, and this thing take away from McDonald's, you know. And so it's a very clear message that we have changed as people, and that's why these things are there. But we also know more, and so it's a combination of that. You know?
Sure. So definitely, then, you know, Doc, you point at the fact that lifestyles are very important. So we're speaking of things like fast food, and so, you know, overall just obesity, gaining weight in general are things that, you know, will ultimately contribute to just even, you know, creating this irregular patterns like PCOS and endometriosis, though no.
No, endometriosis is inherited.
Completely, it's inherited. Okay.
And so is PCOS to some point, because many people have a gene for getting big, but we've made it worse, because if you look at all the PCOS patients you see, you're going to find very few under the weight 60 kilograms. People are 80, 90, 100. You know, now whether the weight came first and the disease after, or the disease first and the weight after, is a big debate. But Oxalayo, it is what it is. You know, it is what it is. Yeah.
So lifestyle overall is so important. And then, you know, just pointing at these kids that, you know, have these severe period pains, is it possible? Because I remember there was a time I mentioned this in the previous interview, I used to do this like fundraising of pads, and we would go out, and these are facts that we were getting from Google, of course, and it said, you know, if you exercise more and you eat healthier, you won't have period pains. Is that necessarily the case?
True. And
sorry to all the kids I said that too, I was lying.
And once again, this is an inheritance, right? So you're going to get it, period. And yesterday I did what's called a laparoscopy, which is the keyhole investigation of the insides of a 23-year-old with endometriosis. And this young girl had a huge, what they call chocolate cyst, right? Had a chocolate cyst, and we had to...
Why chocolate, Doc?
Because that's what endometriosis is, fundamentally. Is so you bleed inside spaces where you wouldn't usually bleed. And the blood accumulates and changes color from being bright red to being brown and chocolate-like. So it's old blood. It's an accumulation of old blood. Very destructive.
Yes, and then?
So we had to go in and do that. And she's only 23. Now, the thing that we need to understand is the same way we had an aggressive push about HIV into schools and places. We need to do that about period pain into schools. Because if you don't go into schools, I mean, I go into schools in the township and teachers tell me, she's not here, she didn't come for 4 days. And I say, but do you know that we can actually help her? They say, no. You know, and so there needs to be a movement. Now, the drug I spoke about is expensive. It's like $400 a month. So the government needs to come in, because the same drugs sold to government are like 20 rands free. So there needs to be a movement amongst young women with period pains to enforce the government to have these things in public spaces so that children can be safe. In fact, I'd go as far as saying the schools need to have doctors who fundamentally look after these kids and many other kids that need health, who don't have access into hospitals and nurses. Because that's a big, big money saver for us. If you look at the burden of disease, of endometriosis, and the economic theft that it brings into society, it's massive. It's massive. I mean, people don't go to work. People and people can't have kids. So the psychological effect of that, the mental health of many women because of that, is massive. So if we go in early, we can make a massive difference to their lives.
So everything is about going in early.
Everything is about going in early, going to the right people early, getting the right treatment early, and understanding why you're getting the treatment, I think.
Because, you know, Doc, even as you're saying, I think the first time I visited a gynecologist, I was 25. I was an old gal now.
I was in varsity. I remember I was in varsity, maybe like second year, so maybe 20.
And
it's because my mother enforced that. She was just like, you need to go to the gynae, you need to go to the gynae. Yeah.
Sure, yeah, because, you know, you just never think that, you know, and my mom was a nurse, but it wasn't anything that was like, you should go to the gynae, you know. I literally went to 25, and I'm thinking now, you know, you just...
I think part of the problem is that people associate gynecologists with wrongness of your body.
Yes.
When in fact, wellness is also a big part of that. And if you can get into that wellness space about the wrongness that may come later, you can avoid that. And this is where part of what I'm doing now, part of the discussion we had with pap smears is important, because a lot of general practitioners that refer patients to me with abnormal pap smears have had these patients for longer than 1-2 pap smears abnormal, and something didn't kick in to say these are not results that I should be keeping. So I don't know how to do it, except to utilize the social media now that is available to pump information into people's lives, to say, if your general practitioner or your nurse practitioner doesn't say this about this, you need to go and bypass them and go seek help.
Sure.
You know?
Yeah, the importance is becoming more and more rife. And like you're saying, things that are picked up early can be avoided. Or at the very least, dealt with
much earlier.
And then the effectiveness of it is of the treatment, whatever treatment it is always better when it's picked up at an early.
All the time.
Sure. I think we definitely need to get you in to speak more on endometriosis and PCOS, what they are, because we're talking now, very generally. I've got a very general idea of the two, and I think, we'd love to have you again, Doc, to really tell us what is endometriosis or what is polycystic. I feel like all the ladies should have a sort of idea. But it would be nice to have you again. Thank you so much, Doc, for joining us.
Thank you.
And I think to all the moms, the note would be, if there's anything abnormal before 10, go to the gynecologist.
Well, no. The things we mentioned.
Yes. Yeah, because we're answering the question, at what age should a mom take? So to answer that question, if I could summarize properly, anything abnormal before the age of 10, bring them into the gynecologist.
The things we mentioned, vaginal bleeding, unusual discharge, what appears abnormal genitalia, any abdominal masses that you feel when you palpate the baby, and those kind of things that we spoke about. So there are certain red flags that should be saying to any parent, this child needs to see a specialist of this kind.
You mentioned off air, and you didn't mention it now though, a child feeling full. Yes.
And there's a lump I'm talking about, because I saw a child the other day who's been complaining to his mother that there is a bubble coming out of his stomach. He says he's been telling his mother, but his mother's been telling him, no, you're eating too much. And this child had a hernia. So the hernia was going like that, ballooning up. And so she said to me, she speaks about it, just have a look. And I said, no, she's a hernia, it needs to be repaired. So it just shows you how a child can be ignored for saying something that's appropriate. And many of the kids feel these differences and complain in time. But, parents are like, it can't be an issue, you're young. And so,
And I think what I'm gathering from this conversation is that it's not being paranoid and it's not overthinking. I think it's better to be safe than sorry.
All the time.
If you see something and you suspect, there's no harm in going to see the doctor, and the doctor saying, no, everything's fine.
Yeah. I mean, one of my specialist colleagues did a study. She's a rectal surgeon. And they wanted to see why black patients vis-a-vis white patients for the same diagnosis of rectal cancers died earlier than white people. And it was very clear that we sit on things. We have all kinds of explanations. Somebody goes to the toilet and there's blood, he starts thinking, did I eat beetroot? Or what was that? Or what was that? Do I have piles? Or they try and justify something. Whereas, white folks were like, sure. That's crazy. Boom, gone, straight away. See the doctor. Doctor says, go get a biopsy. In 2 days, there's a diagnosis. Whereas on the other side, we take about 2 months, 2 years sometimes, and this disease goes and goes. So these are the kind of things that we need to teach mothers to be aware. And as it happens with a lot of the young girls, they aren't brought up by their own mothers. They are brought up by grandmothers. And that's where sometimes the gap exists. I found with a lot of the patients I saw, grandmothers were raised, and grandmothers are very detached from these things, and not as attentive to detail. And so there needs to be a conversation with the child all the time. Is this happening to you? Are you all right? Good. This is what we need to know, and move on. So that gap where mothers are working in the city and grandmothers are raising these girls, is an important gap to fill. How we do it, we need to find out.
Sure.
Yeah.
Mouthful, but yeah, I think being an attentive parent is just so important, and so I guess this episode was for all the parents to young girls to be more attentive and to really just pay attention to your baby girl and the different,
and their
shapes
cries.
and forms and their cries.
Bubble.
Yeah,
Take
imagine.
that bubble seriously.
Because you just think this kid is, having
Yes.
this. It's crazy. Doc, thank you so much for
pleasure.
joining us. We'd love to have you again. Like I said already, we'd love to have you again. Thank you so much for listening to yet another episode of the Conversation Capital, where we chat all things to do with everything plaguing society. Today we're chatting all things to do with what age should you take your child to a gynecologist, what are the things you should be attentive of when you've got a young baby girl. And I'm hoping the dads also listen to this.
Yep.
Let's get the dads involved. So if you're a mom that was listening to this, forward it to your husband and make sure he listens. Like, share, comment, and subscribe. Goodbye and God bless.